What if I told you that waking up with a sore jaw or like a sudden tension headache isn't because you have a stressful deadline at work, but because your body literally spent the entire night using your teeth as a crowbar to keep you from suffocating?
I mean, it completely flips the way we think about daily fatigue. And more importantly, it forces us to look at the human mouth as this highly complex survival mechanism rather than just, a cosmetic feature.
Right. So, welcome to today's deep dive. We are exploring the hidden mechanics of what's called preventative aesthetics. And the core mission for this session is understanding why achieving that perfect, gleaming Hollywood smile requires a massive amount of invisible structural heavy lifting first.
Exactly. The paradigm of preventive aesthetics operates on this non-negotiable rule, which is that biological health and functional harmony, they just have to precede any cosmetic work.
Because if you don't do that, you're looking at a huge mess, right? We're trying to save you time, a lot of money, and honestly, a ton of unnecessary dental anxiety by looking past the bright white surfaces. Treating health and beauty as two separate things usually ends in an expensive disaster.
Oh, absolutely. If someone tries to bypass the underlying architecture like the gums, the bone, the airway, just to get straight to, say, the porcelain veneers,
Mm.
the biological environment will eventually reject or just completely destroy that cosmetic work.
So we are talking about the order of operations here. It's like you wouldn't put a fresh, expensive coat of paint over drywall that is actively being eaten by termites.
No, you definitely wouldn't.
Mm.
But people do the equivalent of this in dental chairs every single day because, well, they just want the immediate reveal.
Yeah, that instant gratification. But let's look at the actual biological canvas here. Before we even think about the mechanics of the jaw, we have to look at the immediate biological surface area anchoring everything down, which is the gums and that underlying jawbone structure.
Right, because that is the literal foundation holding the entire aesthetic structure in place. So consider a procedure like porcelain veneers.
Which are super popular right now.
Very popular. And these are incredibly thin, custom-made ceramic shells that are bonded to the front of the teeth. The instinct for the patient, and sometimes even the practitioner, is to focus entirely on the shape and the shade of that ceramic.
Just how it looks on the outside.
Exactly. But the soft tissue surrounding it actually dictates the entire architecture. If a patient has active gum disease, so periodontitis, and they push forward with veneers anyway, they're essentially building a microscopic bacteria trap.
Ooh, wow.
Okay.
Okay. Because the gum tissue is probably inflamed and swollen from the infection at the time the veneer is actually glued on. I imagine that completely changes the physical landscape of where the tooth meets the gum.
It alters it completely.
Way.
So a skilled dentist wants to place the margin of the veneer, that's the exact edge where the porcelain stops, and your natural tooth begins just at or slightly below the healthy gum line for a seamless look.
Right, so you don't see the line.
Yeah, but if the gums are swollen with inflammation when they do it, that baseline is artificially high. It's not where the tissue normally rests.
Oh, I see. Which means when the inflammation eventually goes down, or worse, if the disease progresses and the bone and the tissue start to recede, that margin is suddenly exposed.
And an exposed margin is a structural nightmare. It creates this physical ledge on the surface of the tooth. It might only be, a fraction of a millimeter thick, but on a microscopic level, it's a massive cliff face.
And bacteria love a cliff face.
They do. Plaque and bacteria accumulate right on that ledge. And normal brushing and flossing just can't effectively clear it out once it's stuck under there.
So the cosmetic enhancement itself is actively accelerating the disease at that point. Like the bacteria just sit on that ledge, pumping out toxins, which causes the gums to pull back even further, which exposes more of the root. It's just this self-feeding loop of destruction.
It really is. The bone underneath actually begins to resorb or literally melt away to get away from that chronic infection.
Mm.
And ultimately, the teeth become mobile.
They get loose.
Yeah, they get loose. You could have the most beautifully crafted ceramics in the world, but if the foundational bone is gone, the teeth and the tens of thousands of dollars you just invested in them will simply fall out.
That is horrifying. So the biological surface absolutely must be pristine before any bonding material touches it. Let's scale this down a bit, though, to something far more common than veneers, like teeth whitening.
Oh, sure. The most requested cosmetic procedure out there.
Right, everybody wants a brighter smile.
Ugh.
But the underlying chemistry of how whitening agents interact with the physical environment of the mouth requires that exact same health-first approach. You can't just apply bleach over tartar and expect a good result.
You really can't. Whitening without a comprehensive removal of calculus, which is what we commonly call tartar, is a guaranteed aesthetic and biological failure. Professional whitening must follow a comprehensive professional clean, always. To understand why, we have to look at the mechanism of whitening itself.
Hmm.
Materials like hydrogen peroxide or carbamide peroxide, they don't just, paint the tooth white. They cause a complex oxidative reaction.
Okay, so they're actually altering the tooth structure chemically.
Well, they physically penetrate the microscopic pores of the enamel, and they travel into the dentin beneath it to break down the complex pigmented molecules that cause the staining.
So they are essentially shattering those dark pigment molecules into smaller, colorless fragments. But tartar is different, right? Tartar is calcified plaque. It's bacteria that has absorbed minerals from your saliva and literally turned to stone on the side of the tooth.
Exactly. It's basically stone. And that stone is highly dense and non-porous compared to your natural enamel. When you apply a whitening gel over a tooth that has calculus buildup, particularly near the gum line or like in between the teeth, the peroxide cannot penetrate that calcified barrier.
It just hits a wall.
Yeah, it halts the oxidation process completely in those specific areas.
Okay, but let's play devil's advocate for the impatient listener for a second. Let's be real. If someone has a big event like a wedding this weekend and they just want a quick touch-up, is it really that bad to skip the deep clean and go straight for the whitening gel? They might just think, well, the front parts will get white and that's good enough.
The aesthetic result is jarring. It's not what they think it will be, because the clean areas of the enamel oxidize and become brilliantly bright, right? But the areas blocked by the tartar remain completely unaffected.
Oh, so it's patchy.
Very. When the calculus is eventually removed later, you're left with these stark yellow or brown blotches. The contrast actually makes the stains look significantly worse than if you'd done nothing at all.
Wow, okay, so it ruins the look.
It does. But honestly, the real danger is the physiological reaction inside the tooth.
You mean the sensitivity? I've heard people describe it as a lightning bolt hitting the nerve. It sounds awful.
It is severe, completely unnecessary enamel sensitivity. And that happens because of the fluid dynamics inside the tooth. Like I said, enamel is porous, and the dentin beneath it is full of these microscopic channels called dentinal tubules.
And those tubules lead somewhere, right?
They lead directly to the pulp chamber, which is the center of the tooth that houses the nerve. Now, if a patient or maybe an inexperienced practitioner sees that the teeth aren't getting uniformly white because of that tartar barrier, their immediate flawed instinct is usually to push harder.
Like, use a stronger bleach.
Either use a much higher concentration of peroxide or just leave the gel on for way longer than recommended.
Trying to force a chemical reaction through a physical wall, that sounds like a recipe for disaster.
It is, because it means the healthy, exposed areas of the tooth are being heavily bombarded. The peroxide penetrates far too deeply, and it hypersaturates those dentinal tubules. This creates a massive inflammatory response inside the pulp chamber.
So the nerve tissue actually swells up.
Yes, the tissue swells, but because it's trapped inside a rigid tooth, it has literally nowhere to expand. The pressure just builds instantly.
Oh man, that explains why taking a breath of cold air feels like a physical shock. The nerve is literally pressurized and hyperreactive, and all because the foundational step of simply clearing the biological canvas was skipped just for the sake of speed.
Exactly. You cannot cheat the biology. The chemical agents require a uniform, clean surface to process correctly and safely.
Makes total sense. But even if we have perfectly healthy gums and brilliantly white, tartar-free enamel, all of that preparation means absolutely nothing if there is a hidden mechanical habit that is going to smash those teeth to pieces overnight.
That's the scariest part, honestly.
Right. And this brings us to the invisible functional foundation, how the way you breathe actually dictates the survival of your smile. Healthy gums won't matter if the mechanical forces of your jaw destroy the cosmetic work while you sleep.
It's so true. The intersection of airway health, sleep apnea, and restorative longevity is probably the most critical frontier in preventive aesthetics right now. We are so used to thinking of a smile statically, like how it looks in a photograph.
Just a frozen moment in time.
Right. But functionally, those teeth exist in a highly dynamic, high-pressure environment that is heavily influenced by how we breathe.
The connection to bruxism, which is that heavy nighttime teeth grinding, is just fascinating here. Because the cultural narrative has always been purely psychological, right? Like, you have a stressful job, you're worried about the economy, so you grind your teeth in your sleep. It's just viewed as this emotional release valve.
And stress certainly lowers the threshold for grinding. It can make the muscular contractions more severe, sure. But for many patients, the root cause is entirely physiological. It stems directly from the anatomy of their upper airway.
Okay, walk me through that. What happens when we sleep?
So when you enter deep sleep, particularly REM sleep, your overall muscle tone decreases significantly. For individuals with restricted airways or mild sleep apnea, the soft tissues at the back of the throat, so the soft palate and the base of the tongue, they relapse so much that they physically collapse backward.
And they block the flow of oxygen into the lungs so the patient just stops breathing.
Yeah, they literally stop breathing, and blood oxygen levels begin to drop. This desaturation triggers a massive sympathetic nervous system response. The brain senses the oxygen deprivation and hits the panic button.
A survival reflex.
Exactly. It initiates a fight-or-flight response, dumping adrenaline into the bloodstream to force the body out of deep sleep, just enough to restart the breathing process.
Wait, so the brain is essentially triaging the situation. It recognizes that preserving oxygen is the absolute highest priority, so it activates this physical override to force the airway open.
Yes. And one of the fastest, most effective ways the body can rapidly open the oropharynx, because the back of the throat, is to aggressively contract the massive muscles of the jaw. Specifically, the lateral pterygoid muscles fire violently, thrusting the mandible, the lower jaw, forward.
Because the base of the tongue is anchored to the lower jaw, so if you throw the jaw forward, you drag the tongue off the back of the throat, unblocking the airway. That is wild.
That is the exact mechanism.
Yeah.
The body reflexively shifts the jaw forward to breathe.
Mhm.
But as the lower jaw thrusts forward, the upper and lower teeth lock together and grind against each other.
So it's using the teeth as a wedge.
Yes, the teeth are being used as a wedge to hold the jaw in a forward posture. The body is sacrificing the structural integrity of the enamel just to keep the airway open.
That is such a staggering realization. The teeth are acting as a literal crowbar, and the amount of force we were talking about here isn't like, just chewing a piece of tough steak.
Oh, not even close. During conscious chewing, your brain has protective feedback loops. Like, if you bite down on a hard seed, nerve receptors in the periodontal ligament instantly signal the brain to release the jaw muscles so you don't break your tooth.
You feel the pain and you stop instantly.
Right. But during sleep bruxism, because it's triggered by an autonomic survival response to avoid suffocating, all those protective reflexes are completely bypassed. The jaw muscles can exert hundreds of pounds of pressure per square inch.
Hundreds of pounds. Wow. So let's bring this back to the person sitting in the dental chair wanting a cosmetic makeover. Say they have untreated airway resistance and they drop $20,000 on a full upper arch of beautiful ceramic restorations. What happens?
Well, they go to sleep, their airway collapses, that panic response fires, and the jaw clamps down. And honestly, it is a countdown to catastrophic failure.
Because the porcelain just can't handle that kind of pressure.
Right. Dental ceramics, like porcelain, they're incredibly strong under compressive forces, meaning if you're pushing straight down on them. But they are brittle when subjected to shear forces, which is that side-to-side grinding motion.
Which is exactly the motion of the jaw thrusting forward to pry open the airway.
Exactly. When you place delicate porcelain into a destructive functional environment where the jaw is violently searching for oxygen all night, the material simply cannot withstand the physics. The restorations will end up cracked, chipped, or completely sheared off at the gum line.
I can't even imagine the psychological toll of that. You endure all these procedures, you spend the money, you wake up thrilled with the result, and then a month later, you look in the mirror and see your massive investment physically shattered just because you stopped breathing for 10 seconds in your sleep.
I have seen extensive cosmetic work destroyed within weeks because the practitioner focused entirely on the form and completely ignored the function.
It makes complete sense why correcting this functional blueprint is the only way forward. So now that we know an invisible breathing issue can physically shatter an expensive dental investment, how do dentists actually secure this foundation before doing the cosmetic work? You can't just tell someone to stop grinding their teeth if their brain is doing it to keep them alive.
No, you can't, which is why the evaluation phase has to be so robust. Before any cosmetic enhancements are finalized, we have to achieve functional alignment. We have to map out the bite and address these airway restrictions first.
So it's not just about avoiding damage, it's about making sure the beautiful smile is functionally sound.
Exactly. The interventions really focus on manipulating the spatial relationship of the jaw and the teeth. And one of the most common tools for this is actually the use of clear aligners.
Wait, really? Like the clear plastic trays people use instead of metal braces? Because most people view those purely as a cosmetic tool to just get straight teeth for photos.
They do, and they are great for that. But in the realm of preventive aesthetics, clear aligners are used as highly precise biomechanical tools. We are using them to literally architect the bite.
Oh, wow. How does that work?
By gently moving the teeth and remodeling the bone over time, we can change how the upper and lower arches fit together. We can actually widen the arches to create more room for the tongue, which prevents it from falling back into the airway in the first place.
That makes a lot of sense. Give the tongue a bigger house so it doesn't spill into the hallway.
Exactly. And we can also change the inclination of the teeth to guide the lower jaw into a naturally more forward, open, resting posture.
So you are basically building a new default position for the jaw where the airway naturally stays open on its own.
Right. Which completely eliminates the need for the brain to panic and trigger that grinding reflex.
That's incredible. But what about cases where it's more extreme?
Yeah, for patients where the airway collapse is more severe, or maybe where orthodontic movement just isn't enough, we utilize custom sleep appliances. Mandibular advancement devices, or MANADs for short, are specialized orthotics that are worn only at night.
Okay, but how do those differ from the bulky over-the-counter mouth guards people buy at the pharmacy when they notice they're grinding? Because a lot of people just go buy a $20 guard and think they're protected.
That's a huge misconception.
Yeah.
An over-the-counter night guard is essentially just a piece of soft plastic that sits between the teeth. Now, it might protect the enamel from direct wear.
Like it stops the teeth from actually touching.
Right, but it doesn't stop the muscle contractions. And crucially, it doesn't open the airway at all. In fact, putting a bulky piece of plastic in your mouth can sometimes push the tongue further back and make the airway collapse even worse.
Oh my gosh. So it might save the tooth surface from wearing down, but it actually exacerbates the breathing problem that's causing the grinding in the first place.
Exactly. It's fighting the symptom, not the cause. But a custom mandibular advancement device is fundamentally different. It physically engages both the upper and lower teeth, and it holds the lower jaw in a precisely calculated forward position throughout the entire night.
So it's doing the work for you.
Yes. By artificially maintaining that volumetric space in the oropharynx, the airway never collapses. The blood oxygen never drops. The sympathetic nervous system never fires.
The muscles stay relaxed, the grinding stops, and the cosmetic work you're about to place is entirely protected from those crazy shear forces.
Exactly.
But this clearly adds steps before you get the final aesthetic result. How does fixing a hidden airway issue first actually translate to a better experience for the patient in the long run? Because we live in an era of immediate gratification. You watch a video online, someone walks into a clinic, and they walk out with a new smile the same afternoon. You are talking about a process that involves screening, maybe wearing aligners for months to remodel bone, or adjusting to a sleep appliance, all before the final porcelain is even ordered.
It absolutely requires a massive shift in expectations for the patient. But the alternative is practicing reactionary dentistry. If we rush to the final aesthetic result without establishing that functional baseline, the patient will spend the next decade trapped in a cycle of dental emergencies.
Just constant repair mode.
They will constantly be back in the chair, having chipped porcelain polished out or completely broken crowns replaced.
It transitions from the joy of a new smile to the chronic anxiety of just waiting for it to break.
Yes, and that is a terrible way to live. When the structural foundation is ignored, the patient lives on edge. They bite into an apple and hesitate. They wake up with sore temporomandibular joints and panic that they ruin their teeth overnight.
Which totally defeats the purpose of spending all that money to feel confident.
Exactly. The delayed gratification of preventive aesthetics buys long-term peace of mind. When the bite is balanced and the airway is clear, the patient can actually enjoy their smile, knowing the mechanics beneath it are sound. It ultimately saves patients significant time, wasted money, and so much dental anxiety.
A smile really is an incredibly complex biological system. What we've unraveled today is that treating it like a simple cosmetic upgrade is a recipe for failure. To actually protect that investment financially and biologically, you need healthy periodontium so your gums don't recede and trap bacteria.
Right.
You need a tartar-free enamel surface so whitening agents can oxidize pigments without inflaming the nerve. And, perhaps most surprisingly, you need a clear, unobstructed airway so your brain doesn't recruit your jaw muscles to smash your teeth together in a desperate bid for oxygen.
The aesthetic outcome is simply the final visible layer resting on top of a very deep biological and functional foundation. Once you understand the mechanics, you realize that true cosmetic success is honestly indistinguishable from optimal health.
It totally changes how you look at the whole process. You don't just see the bright white surfaces anymore. You see the functional airway, the stable bone density, and the relaxed musculature that actually allows those teeth to exist safely.
It leads to a fascinating consideration, too. especially regarding that hidden connection between our breathing and the mechanical forces in our head and neck.
The idea that we are fighting a battle in our sleep without even knowing it.
Exactly. Next time you wake up with tired facial muscles, a sore jaw, or an unexplained morning headache, don't just write it off as the residual stress of your daily commute.
It might be so much more than that.
Consider that your jaw might have spent the entire night generating hundreds of pounds of pressure in a violent physiological fight just to keep you breathing. It really makes you wonder how much of our chronic daily fatigue, our tension, or our unexplained aches are actually hidden dental and airway issues just waiting to be uncovered by someone willing to look beneath the surface.
Wow. It really makes you reconsider what the body is doing when you close your eyes. Keep questioning the structural foundations of your own health, and remember, before you admire the fresh paint, make sure the walls are actually sound. We'll catch you next time.